Welcome to a Shot in the Arm podcast. I'm your host, Ben Plumley, and this is a podcast about global health and human rights in the brave new COVID world of pandemics preparation. We're brought to you in partnership with the Bay Area Global Health Alliance, a hub of academic, tech, biotech and other companies, non-profits and community organizations based in the San Francisco Bay Area and all committed to improving the health and well-being of people around the world. You can find out more about the Alliance at www.bayareaglobalhealth.org. Well, everyone's talking about the vaccine, who can and can't get it, which is the best one, and what can you do after you've been vaccinated? But in this episode, we're going to look at some of the other impacts of COVID-19, and particularly after a year and 3 months into the pandemic, its impact on mental health, pernicious, and in a very different way, just as threatening as the viral infection itself. And so I'm delighted that we're going to be rejoined by one of our favourite physicians and previous Shot in the Arm podster, Dr. Huma Abbasi. Huma, welcome back to a Shot in the Arm podcast.
Thank you, Ben. Good to see you and good to be here again.
So I guess we spoke just about a year ago about the impact of COVID-19 and shelter in place. But can you remind our viewers and listeners just a little bit about yourself, how you came to be interested in health, how you decided to become a doctor, and how you ended up at Chevron?
Sure. So basically, my job is the Chief Medical Officer for Chevron. And in this role, I'm responsible for, with my team, deploying programs that impact more than 50,000 employees, double the size contractors, and we also bring similar programs to the communities. And it is this broader scale and outreach that basically attracted me to this job. So I am a doctor by profession, as you mentioned. I grew up in a third world developing country, and I was amongst the fortunate who had the opportunity to get advanced education and become a doctor. And one of the reasons was because my parents themselves were university educated and put a priority on getting higher level education. At that time, when I started my career, I started from hospital care, working with patients one-to-one, and just the idea of helping people in health and their families was very self-gratifying. But even at that time, I thought that I wanted to do more. And early in my career, when I was in Asia or when I was in remote countries or places where the health system was fragile, I noticed what an organization like Chevron or a multinational company can bring to the table when they work with the governments, when they work with NGOs and people who have expertise in bringing health programs to those places and bridge the gap in between what the local system cannot provide. So that got me very, very passionate about changing careers. And then this is how I moved from one role, which was providing patient care, to a bigger organization where you can reach hundreds and thousands of employees and deploy those programs on a larger scale. I'm very proud of what Chevron does. We have health programs that reach communities in many places, and we put a priority on health and well-being of not only our employees, but our workforce, our dependents, the contractors, and our communities. And this is what makes me very passionate about the job even today.
Well, we know Chevron's leadership in infectious disease, in HIV and TB particularly. But as you look over the last year of the COVID-19 pandemic, what do you think the lessons learned are?
Yeah, so we actually, if I remember, we started the response to COVID-19 starting December 2019. In fact, if I remember it correctly, at that time, this was not the disease didn't even have a name. We were calling it a pneumonia of unknown origin. But as you know, that Chevron is a global company, and we have operations in Asia. And we wanted to make sure that even this small outbreak had a good response in the country. So we started looking at guidance. We started looking at resources, central resources, and how we can understand. And we did a needs assessment. And based on that, we started a response for COVID-19. Going forward, in a couple months, when this outbreak became an epidemic, and then very soon WHO named it a pandemic, we knew that we had to extend this response beyond a region, and that's where our company developed a coordinated central response, and we activated a team which is now called the Corporate Pandemic Response Team. This team is chaired by my supervisor, who's Vice President HSC, and I lead the functional team for health and medical, which is basically the medical response. The situation has been very dynamic, and in the last year, when we made sure that we were changing the response and upgrading our services based on what the needs were. Some of the lessons we learned: one is that we were very confident that we had a good foundation to start with. As you know, that this may be the first time we're dealing with a pandemic, but not the first time we've dealt with an outbreak. We have managed several outbreaks in the past, whether it was Ebola in the Africa region or it was a polio outbreak in a small country in Angola. But we know we had systems and processes to activate an emergency response, just on a bigger and larger scale. So we using the learnings from the past, using our partnerships, internal as well as external partnerships, we deployed that response. And the one good thing about this was that, the burden was not just on the medical team, but this corporate pandemic response team brought all the leaders in logistics, procurement, human resources, IT. And so we could leverage from each other and provide a consolidated but a strong, robust response to our countries. And through this corporate pandemic response team, we produced guidance documents. We did webinars for our workforce, which was about education awareness. So one of the lessons learned that, don't do it alone. Always have this central coordinated response, because, you will need help from everywhere. The second thing we, of course, realized that, we will have, it's a very dynamic situation, and we'll have to make sure that we keep shifting resources. So, for instance, COVID-19 testing in the beginning was not available in some of our remote operations. And we wanted to make sure that when we were mobilizing workers for our critical infrastructure, we had testing available. And we, at that time, were able to manage some central contracts here and work on getting some COVID-19 testing machines or test and send it to our businesses. And this is something that they appreciated a lot, because at that time, the countries which were very active in the response, and they did not have time to work these little details. So that also shifting the resources and getting aligned with the local governments was very, very important. The third thing I will point out is just finding the right expertise, because I know that we have a lot of great health professionals in the company, but we also know that sometimes that is not enough for the response. So we formed alliances, and we knew that some of our existing partners were doing the same thing. So we wanted to bring those learning and those relationships with our external partners and help them help us provide this response. So we really leveraged on those existing networks and resources through some of those partnerships. The other thing I would say is that I know we are going to talk a little bit more about the mental health issue, but Chevron is a company that has a good foundation on mental health programs, and some organizations I know were a little late in identifying that we will need a mental health response. But just because we already had a solid foundation on mental health programs, we integrated mental health programs and offerings into our existing response, and early on started identifying the need in U.S. domestic and internationally and in other countries to make sure that when we address the health needs, it is a more coordinated response and physical, emotional, psychological well-being of our employees.
So we'll come on to the mental health response in a second. I'm just a couple of questions beforehand. Have you have you thought about vaccines and what the company can do in partnership with some of the countries that perhaps have not been at the forefront of receiving COVAX supplies of COVID vaccines?
Yes, of course. Just like everyone else has eyes on vaccines, we have been monitoring and researching the availability and access of vaccines. Early on, as part of our corporate pandemic response team, we developed a group, which is the Vaccine Work Group or Vaccine Task Force. And that Vaccine Task Force is comprised of experts from around the world, from my team, and some of the other partners we have. And we started researching and analyzing information. The one thing we wanted to do definitely was to keep the communication going with the workforce and have them engaged and provide them current but credible information. So we were looking at vaccine hesitancy. We were looking at maybe perhaps there was some misinformation in the beginning, and providing all those resources and tools to our global operation to make sure that they get updated and current and correct information. So that was one of the things we did through the vaccine task force. The other thing that we knew that we wanted to do was important to look at access. And we know that, initially and even now, a lot of the vaccine access is government control. And, it is being managed by local jurisdictions, but we wanted to start early on. And we have started engaging our local and international partners with a hope that whenever there is an opportunity for public-private partnerships, we will be there at the forefront. We have, though, been successful in deploying some of the local responses, like, for instance, for our domestic operations, we activated our pod teams, which is basically point of dispensing teams through the local counties. And we had signed off those agreements early on. And just this last week, we started our pod team vaccination in our Houston office, which is basically our own team, health and medical team, providing vaccine, working with the county to the Chevron workforce. We are very interested in bringing vaccine, especially to the lower middle income countries, and are trying to work to make sure that we enter into these philanthropic efforts, or maybe perhaps working with the governments. We can either put some investments, charitable donations, or something that can help not just the Chevron workforce, but our communities as well. We started an operation in our TCO business unit, which is in Kazakhstan, and working with the local government was able to provide, initiate at least a project with 4,000 vaccines given, and we are continuing to work on such programs.
I mean, that sounds really important, and again, at the forefront of these public-private partnerships. There's a question I often ask guests, and whom I would really love to know your thinking about this. What do you think the new normal is going to look like? I mean, both as a family person, a parent, as well as being a senior executive in a large multinational corporation.
Yeah. So, if I can just go back a little, Ben, if you look at the last year, I know that we went through unprecedented times. And I know this is sort of a cliche. People say that because we've been saying that for a long time. But our people went through a lot of change, whether it was dealing with a pandemic, economic uncertainty. We all saw what was happening with racial inequity and social injustice. And on top of that, Chevron went through a huge transformation effort, although that makes our company very strong. But anyways, this is all that was just being thrown at people. And you can imagine what kind of change everyone went through. Plus, just seeing the devastation and damage COVID-19 brought, even if you are someone who did not have direct impact to your family, of course, it impacted the overall mental health condition. So we have seen that, initially when we did the surveys, we saw that people were very stressed, and there was a lot of anxiety amongst our workforce. when we go fast forward and start to look at the new normal, I had to actually sit back and think, and is that just a fancy term or is it real? And I know that this is very, very real.
Mm.
Because for one reason, being a health professional, I don't want to go back. If I did mention the inequities COVID-19 highlighted, and I know that one good thing that COVID made us see was the disparities that existed in our health infrastructure. And I would like to think that moving forward, we would like to close those gaps and make sure that in the future, if we have any health crisis, we don't see those kind of disparities. The other thing we've already seen is that we've learned how to work differently. Even though in the new normal, I look forward and I'm excited to get back together and start traveling again, which hopefully will happen once the majority of population starts getting vaccinated and the virus transmission is lower. I do believe that we will have new ways of doing our work. We have started engaging more and more on virtual platforms. We saw there was so much research done in terms of health technology and innovation. And I think using those the digital platforms or telemedicine or telehealth, we can even improve our existing outreach for health programs in the new normal. We know that certain people have started working remotely, and when we go back, perhaps we can think of a hybrid on how we work, but we will be taking advantage of all that we have learned in the past year.
So that really brings us on to mental health. It's been a major challenge as part of the overall COVID response, and I wonder how much, as a physician, how much of an issue you feel this is for both for families where one or more people are infected with COVID, but for the overall community as a whole. How big an issue is this?
Yeah, so as I had mentioned earlier, in 2020 and continuing this year, we have seen a lot of stressors, whether it was dealing with the pandemic or managing a family situation at home. We saw that the kids were not going to school. And as a mother, I had that experience firsthand where we had to learn how to provide education to our kids in a virtual environment. The other thing we saw is that, the health, physical and mental health was impacted together. Both of these are interconnected and you cannot separate one from the other. When people are mentally stressed, you have anxiety, you have fatigue, and you have all these symptoms that can become real illnesses. People, the nutrition was not the same. Exercise patterns changed, and even physically, we were not able to keep up with what was going on in the beginning when COVID transmission was quite high. People missed their preventive health screening and appointments with the doctors. So that itself put a lot of burden. I was looking at some studies, Ben. One is that, we see from surveys that were done in many countries and even here domestic, that there has been an increased uptake in substance abuse and increase in alcohol. And the other thing is that, there are some people who are really dealing with sick elderly or sick people at home, people who have developed these long-term symptoms of COVID, and there has not been, any relief for them. So then the other thing is that, we have different types of issues. For instance, the frontline workers. There are some workers who never, were working from home from day one of COVID. They have been going to the facility, so they were faced with different problems like trying to do their job, trying to manage family issues, while some workers who were remote and working remotely had blurred lines and were always on and could not separate in between what is work and what is home. So all kinds of stresses did put a burden on mental health. We did some initial assessments and surveys and found that people were reporting of increased stress and loss of work-life balance. And those are then there were several different issues. The other thing is that, one size doesn't fit all. We know that, for Chevron, we are in different countries, different places, and mental health stigma is different in different countries. We see in some places people in Asia, we learned that people try to put a very strong face on, and they would not talk about mental health. So there we had to improvise our programs and see how we can customize the health offerings we have over there. In other places, we saw some generational gaps. So while the senior people who were not very savvy with technology had difficulty in working, our younger individuals and younger adults completely lost their social environment that they are very much relying on, or that interconnectedness was not there. So this is why we saw that mental health stresses were higher on the rise in the last 1 year.
I mean, this seems to me another example of the approach that I know you've taken of the sort of whole health approach to that, to the wellness of employees and dependents. The idea that it's not just physical health; it's mental, spiritual health, even, and trying to drive down, the indicators of stress. And this must have been a major challenge for you and your colleagues over the last year, because, as you said, so many people are either working from home or have frontline jobs where they have to be on the front line. How did you use, say, technology and some of the newer social media applications to reach out to people, but also to give them the tools, perhaps, to look after their own mental health?
Yes. So one of the things that we do understand is the connection in between physical, mental, emotional health and well-being. And I know that all of this is related to safety, performance, and productivity. And this is why, from the very beginning, we have put a lot of emphasis on mental health. So Chevron is a company that has had these employee assistance programs for a long time. In fact, this year we will be celebrating our 50th anniversary for EAP organization. And as part of that organization, not only we have a team of experts, psychologists, social workers who provide consultations and bring tools and education awareness webinars and programs for our employees, but also we are engaged and in doing a listening tour and understanding the mental health needs of our global operations, and then customizing and designing our programs best suited for that
Huma,
region.
can I just dive in there? You used the term EAP, and I know it's central to what you do. Can you just explain what the acronym is?
Yes, it's Employee Assistance Programs. And this is a team of individuals that we have internally as in Chevron. Basically, they are experts as psychologists and social workers, or internal advisors, what we call them in Chevron. And what they do is they do, just like any other health professional in Chevron, they do a health need assessment and then design and develop programs that are best suited for Chevron operations. So
what makes you different is that many other corporations, not just in the energy sector, tend to contract that out. But in Chevron's case, you've made the very conscious decision to keep those resources and that expertise in-house.
Yes, Ben. So I think that is one of the advantage we always had. And if you remember, I mentioned that our mental health program was integrated into our corporate pandemic response team response early on as part of the pandemic. One of the reasons that we had this was because we already were in a 3-year campaign, Let's Talk, which is from our EAP organization. And as part of that campaign, we were trying to educate our workforce on mental health disorders, or if you put it a spin positively, on mental and psychological well-being. And this is why when we were hit by a pandemic, we started looking not just at the physical needs, but also at the mental needs of the workforce. And what we're doing right now is we have an abundance of tools that have been made available from our EAP or Employee Assistance Programs team. We have one company program that I'm very proud of, and it's a resilience app. What it does is it's a free app for every employee in the company. Once you download that app, you have access to a number. You do a needs assessment or survey, which is kept confidential and not shared with anyone, but it is done through a third party. And based on that assessment, you can receive counseling, and you receive help from whatever you have, meditation, so many abundance of resources through that app. And I think that has been one of the very successful programs for Chevron. We are engaged in providing different tools and resources through our new digital platforms. I have an example here in Thailand from last year. We used telehealth services for our mental health program, and it was very, very successful. And I think one of the gaps that I hear from in many places is that the reason that people were not seeking help related to anxiety, depression, or other disorders was because the earlier connection they had with their psychologist was lost. People were not making these physical visits. But by having these innovative technology and platforms, we were able to use those platforms but continue the outreach and the programs that we had existing within our system. So I think that was a huge advantage. And I think, like I said, we've learned a lot in the past 1 year. I don't think that we will stop here. We will, of course, continue those physical programs and live programs that we have, but also at the same time, we will continue using other platforms and technology, not just for our physical health programs, but also for mental health.
So May is Mental Health Month, and I know the company's got a number of specific events and activities. But I guess my first question to you, as as the chief medical officer of Chevron, is honestly, do you think these health months have real impact that go beyond the month-specific events, or do they bring something that you can capitalize on throughout the year?
Yeah, so that's a good question. We will be celebrating the Mental Health Month, and in fact, we have planned a whole lot of activities around mental health programs during that month. We have some pre-recorded events that will be given to the employees. We have some tools that are ready and available for the employees. We have a lot of topics that we are focusing on. So we want to make sure that people understand the role of psychologists, understand the difference in between regular stress and this clinical stress or clinical depression that sometimes people face and are not able to seek help because they don't understand the difference. We will be addressing children's mental health, which I think is a very, very important issue for us. We are working on some communication that will be done during that month, whether it is through our Inside Chevron website or through social media posts. We have a lot of ongoing programs like Resilience, that mental health program, but I think what this focus during a month will do is concentrate all those activities and communication to our employees, and we will work really hard to make sure that during that month we put a focus and priority on these programs. So I do know that sometimes we think that we have something celebrated every month, but we use it to our advantage to make sure that we impart education awareness to our employees on whichever health issue we are focusing on. And pandemic has shown that mental health is a need, not just in this country, but everywhere in the world. And we want to make sure that we take advantage of this month of May to provide all that education, awareness, tools to our employees so they can really learn and improve their skills.
So I think you've answered this, but it might be worth for our listeners and viewers to have this perhaps a little more explicitly. One concern, and this is certainly something we've seen with healthcare workers, is a hesitancy, not just about the vaccine, but about admitting the stresses, admitting the mental health issues, and a concern that employers might view that as weakness. Now, you've clearly emphasized that the range of services that you provide are there to support employees during periods of stress. But what would you say to people who say, well, of course, you don't want to indicate that you are feeling stressful or you're perhaps having mental health issues because that'll put your job at risk?
Yeah, so that's a very pertinent issue, Ben, and we have seen what we call a COVID fatigue for a little bit now, and it's not just for the healthcare workers because in healthcare we feel that we are there out to provide care to the rest of the workforce, and sometimes you forget to see how you are being burdened and fatigued by that response. So we did bring out programs where we were able to listen. I think the best thing to do is first listen and acknowledge that we could have mental health issues amongst our workforce as well. We in the early on we started doing surveys and trying to identify what are these stresses, whether it's work-life balance or just the amount of work that has been put on people. And after that needs assessment, then we were able to customize the tools and the resources that we provide to our workforce. I think, like I said, sometimes people respond to different things due to our different backgrounds and cultures, because our ethnicity and our background shapes how we look at mental health. And in some cultures, there could be stigma. Sometimes, like I said, we've seen that people will try to put a strong face on because they feel like they are supposed to be strong for the family. So one thing we've done is that we have talked openly about this. We try to listen to people. We try to openly address this issue. We're trying to make sure that we have an outreach program where people can go, but also have anonymized surveys. We have consultations available for employees so they can go and reach confidentially to people and talk about it. And at the same time, I think the important thing is that we have tailored programs for the supervisors, for them to understand what their teams can be facing and how they can talk about mental health issues openly and try to help the families. In the beginning of the response, our human resources department was very good in identifying some of the things like childcare. We knew that when people are when you have restrictions and lockdowns in place, people will need help on childcare. We looked at our policies on disability, and if you have a sick individual at home, how we can help the employees. So I think it's everything together, looking at the physical and mental health needs, providing education, but also at the same time, it can't be all talk. It's also action. So we wanted to make sure that we have those resources available to the employees that they can make use of, and at least that will help them with the stress they are facing in the current environment.
So I know we're coming up to the top of the hour, and I need to let you get on with the very important work that you are doing. Huma, I've got two questions remaining for you. The first, to change tack a bit, is about the Bay Area Global Health Alliance itself. You were one of the early supporters and members of the alliance. And in this last year, we've seen it grow significantly, notwithstanding the shelter-in-place orders here in the Bay Area. What are you most proud of, and what are your hopes for the alliance in the coming year?
Yeah, I mean, I'm very proud of Chevron being the inaugural member and a supporter of the alliance from the early days. And the thing I like about this alliance is that it puts all these thought leaders together and on a common agenda. We work on shared goals, shared objectives, and common agenda. And in the last year, the alliance has grown so much, and I'm so proud of it. I think the one unique thing about the Bay Area Global Health Alliance is that one of the things that I see is the opportunity to bring all the expertise across industry. We have people from academia, pharma, oil and gas industry, many other industry members represented at this Health Alliance. And we are thinking of the same things. We want to make sure that we elevate the global health agenda and work on creating these innovative solutions to bridge the gaps and help with the health crisis, whatever it may be, whether it's COVID-19 or something else. And in the past, I saw a lot of work done through the Bay Area Global Health Alliance. I'm looking forward to what we can do in the future. I'm pretty sure that we have learned so much from this pandemic on how we can bring all these thought leaders together and work together, and we will continue to work on this platform.
Now, I know, and I asked this question of you last year, that you actually don't watch much television, and besides the demands of work, what you tend to do is read clinical and public health research. But I've got to ask you, what is keeping you interested at the moment?
I think just the new research. It's just such a dynamic situation right now. What we learned, I think in the past year, we learned humility. We learned to lead with empathy. We learned so much about science and medical and health innovation. And that keeps me going, Ben. I just, I wish I had more time, but I keep myself updated on the new research, on what the science is telling us, not just about COVID, but about new therapeutics and new diagnostics. And so it is, that's how I spend most of the time. I do take my breaks, and I think you may be able to relate to that. My idea of de-stressing is curling up on a sofa, watching an Agatha Christie movie with my cup of English tea.
Oh, yes, I can relate to that. I'm afraid at the moment it's the Great British Bake Off, and the new season of that, which is keeping me thoroughly occupied when I'm not thinking about this stuff. But Huma, thank you so much. And I wonder if there's a standing invitation to you to come back onto the podcast at any time, if there are things that you feel, both from the work as the clinical leader of a large multinational corporation, or indeed as a physician, that you think our listeners and viewers should know, and things that we can do to support you. So thank you so much for coming back onto a Shot in the Arm podcast. You are, of course, yourself a shot in the arm.
Thank you, Ben. It was a pleasure, and keep up the good work.
Well, thanks to Huma and to her colleagues in Chevron and Health and Medical, including Janice Davis-Street, Mike Sternberg, Bessie Gutierrez-Aguas, and Amy Landre. Thanks also to Sarah Anderson from the Bay Area Global Health Alliance. Our deepest thanks go to our director and producer, Eric Espera, without whom none of this would be possible. And finally, thanks to you. If you have any questions or comments about this, or indeed any of our shows, don't hesitate to contact us through Facebook and Twitter at ShotArm Podcast. We'd love it if you leave a review on Apple Podcasts and give us 5 stars. It helps us get the word out. So, have a great week and a safe week, everyone. And if the COVID vaccine is available to you, remember, vaccinate, don't hesitate.